today I have a very, very fantastic guest and a very dear friend. Even before I introduce the guest for the day, I would like to um, talk about my own experience with this guest. Uh, Way back in 2017, my dad was on his deathbed, and this person called me from UK, and he told me this. Of course, even before that, also we had conversations almost every alternate day. He was talking to the cardiologist who was treating my dad. But there was a point wherein I was so stubborn and I was saying this: irrespective of whatever money that needs to be spent, we are ready to spend, but I want the dad back. Uh, this is such a difficult and very sensitive conversation. And this dear friend of mine calls me up at 11 o'clock in the night, India time, while he's driving back from his hospital to home. And he says, look, I really appreciate what you are doing, but we should also, one thing that you have not thought of so far is what is your dad going through, right? And at some point in time, if you really care and love your dad, you should very peacefully allow him to go. And that is such a difficult conversation, and nobody else can. It is very, very rare to have a friend calling up and talking about your dad when he's in his deathbed. And I would say people may call it being practical, being real, but what I see is a lot of empathy, right? It is not just empathy for me, it is the empathy for my family, right? So today I am so very lucky to have Dr. Satish Babu. Satish Babu is a senior consultant nephrology in UK, and he is visiting India for a very short duration. Tomorrow morning he is leaving. That's why this episode has to be done today. Dr. Satish Babu, welcome to this show. Welcome to this talk show, Synced with SK. And I'm pretty sure you're very open to be vulnerable, talk about your failures. One thing that I would like you to think about is when you talk about your failures and vulnerabilities, there would be a lot of people who would look at it and learn and move their life at least by a millimeter. If 10 people move their lives forward by a millimeter, I think this podcast is successful. Right? So with that, once again, welcome to you. How did you become so empathetic?
Thank you very much. SK, I'm really honored. I agreed with a lot of the things what you said to start with, but when you said, I'm going to invite you to this podcast, and also you said that we want to talk to how successful you are. That's one part which I don't really agree with. I mean, yes, what I've done is like many other people of at my level would have done pretty much similar. I come from Bangalore Medical College, which is a government medical college, and we've got plenty of colleges like that. And this is not my story. This is the story of a lot of people in the government medical college would have gone through exactly the similar process, maybe with slight variations. So there are many, many successful people. So apart from that, yes, I'm very glad to be involved and talk about my journey. And if I can be of any help to anybody through this podcast, I'll be very grateful.
Thank you very much. How did you become so empathetic? While you said that many people have been successful, I agree with that. But people started at their starting points were different, right? So starting at different starting points and reaching the same place is an achievement in itself, right? So we would talk about your starting point as well. So I am pretty sure that your starting point has a very strong connection with the empathy that you have for people around you. People feel safe around you, right? So my question is, how did you become empathetic?
Well, I think it's not difficult, because if you look at the upbringing what we had in 1978, I think we came to Bangalore from Kolar, and I still remember I was 5 years old. I still remember that day in my memories. We came to Bangalore in an auto rickshaw. We came in the bus, and then from Majestic we came to Magdi Road in an auto rickshaw, and all the stuff we had was mom and dad, me, my sister, and my uncle who joined us. We sat in an auto, and we had a sewing machine as well with us. So we carried that from a village in Kolar, Muduvati, and a trunk, iron trunk was what we had. So you can imagine how much more space will be there in an auto, and that's the journey we began. And from there, and now I'm sure if you clean the house every month we get shed loads of stuff to cluttered stuff to throw it out. So that's the journey I had. So if people who have similar journey, I think most of them it just comes from. And mom and dad have sacrificed a lot. They worked extremely hard. Coming to Bangalore with no job, both mom and dad, they did not have any job when they came to. And again, when you say successful, why empathetic, there are innumerable number of people who have helped us at various levels to be where we are now. And it's, yes, in the struggling days, it was a lot of people, genuine help with financially and in other ways. And we think that is one thing. But even now, at every point, if you want to do something and if something has to go right to you, it's the combination of a lot of factors, a lot of things will be helping directly or indirectly. So even at this stage, we can't just do things on our own. It is the combination of people around helping you in various ways. And so when you have that realization, it automatically keeps you, okay, what have you achieved? It's not your achievement. It is because people have worked so hard. I mean, look, today we are sitting here talking to each other, and we realize how much work everybody has put in to make this happen. So I think we all have to be mindful of that.
Thank you very much. That's a fantastic point. There are ton-loads of people who do not even realize this. How did you get that realization? What is it? What quality should you have to look around and get that realization?
I think it is there in the open. See, we just have to open your eyes. I mean, people sometimes, I feel they get blinded to things around, and they think that a lot of the achievements what they have is their hard work and their own efforts. I think maybe in the early stages it might be, but as you grow older and as you become wiser, you will realize that it has to be various factors has to come into place for you to achieve. So again, going back to the way we were brought up, we have 4 kids, and mom and dad with working. My dad was working in a private company for 300 rupees salary, and he has to do 2 jobs, one in the day and one in the night, part time for few hours. And there are times where I've seen my dad has not slept for days. Especially, he was working as a cook for the weddings, and in the wedding season, he used to be busy because that's for a short period of time, and then daytime work in the office and nighttime work in the weddings as a cook, and go to work in the morning. I used to see him. I still have very, very good memories of my dad. After a few days, he used to be so tired and sleeplessness, but never got angry on us, and he still has so much, want to give so much to us at the time. I think if you remember those things, it just shows what you've done is I mean, I can never imagine that I would work to any extent as hard as my mom and dad have worked. Mm-hmm. So those are the things. If you've seen that, it's not difficult.
Okay, understood. So because of your humble background, humble beginnings, when you went to school, did it make any difference in how people treated you, and was there kind of looking down, those things? Did you experience any of that?
Yes, financially we were very poor, but thankfully I was reasonably good in studies from the very early stage. And because of that, I didn't have to face too many difficulties actually. I studied in Bagdi Road in a very mediocre English medium school. A lot of children were similar. There were some rich kids who used to try to bully. That was a small part, and I still remember. I mean, people didn't like me at some point because I was very good in most of the things I was doing, like studies, playing sports, and that's part of any kid growing up. Um, in spite of that, I had like fantastic school life. In my high school, I still remember we were in English medium school, but our school was in a state where not many people spoke in English. And even at high school level, there were kids who didn't understand the language. So, and I used to, after school, I used to sit and take lessons, explain them in Kannada and make them understand, do some sort of tuition to my own classmates. It was not tuition, it's just like trying to help them to understand the subject and get through the exams. So those are the things which made me very popular in school.
Today, the world says, okay, you should not put too much of stress on kids or stress on kids, all those things. But looking at where you came from and the constraints that you had, financial constraints that you had, did it nudge you to study more?
Yes,
Yes, what a positive
no, absolutely. See, one of the things I'm very mindful. See, for us, the only way of me having a good life is through education, because we had not much money. We had no money. So the livelihood to make our lives better, the only way is to study and come up in life. So it is the process. I wouldn't say it's hard work, it's the process. So whereas when you have everything on the plate, people still study hard and get good grades and achieve a lot of things in life. So even that is, people have to be mindful. That is also very hard. When you have like virtually everything at your disposal and you still have to study, people think that, oh, he's got everything. His dad has given him good tuitions and provide everything what you have. So it's a lot easier for them. But they don't understand you still to be successful to do what you have, you need to have the fire in the belly. So for underprivileged children, it's a lot more easier, I would say, to achieve than people who have everything.
Yeah, absolutely. So my takeaway from this example is there should be at least some positive pressure for somebody to perform, right?
Absolutely.
Without any pressure, it is like walk in the park, right? Dr. Babu, can you talk about one of the episodes that happened in your life, which kind of, I mean, I'm talking about until high school, right? That kind of changed the path that you wanted to take. What was it, and what was the actual trigger?
In terms of, you mean in the high school?
High school. Until high school, anytime, right? So
I think school life, it was a very simple life. So all we were focused on in the early years was getting 3 meals a day, going to school, paying the fees. I think from year 1 to year 10, all the 10 years, we never paid the fees on time. So the situation was from month 1 to say month 10. So it's generally 10 months of school fees. In that, at least 6 or 7 months we would have been due at the time of the exams. And at the time of exams, you have to pay the fee in bulk to get the hall ticket to sit in the exam. And at least in 10 years, 5 or 6 years, where we couldn't even pay the fee at the time of the exam. So my mom used to come to the school, get special permission from the headmaster and allow me to sit the exams, because they knew that I was a good student and they didn't want to compromise my career, and they always allowed me to sit the exam. I'm very, very grateful to my headmaster in school. I'll talk about him a bit later. And once the exams are over, my full fee was paid before the start of the next school year.
Okay.
And then they were very strict. They didn't allow me to continue, start the next next level before paying the fee. And then it's always used to be borrow money from somewhere or mortgage something and pay the fees and go to the school next. And our fees were very minimal. I still remember it was like 30-40 rupees a month. I think that's probably till my high school levels. It's for not more than 50-60 rupees per month. And that was difficult as well. And my results were not given to us until I paid the fees. The way I used to, majority of the years, the way I used to get the results is, it used to be either first rank or second rank. If my friend, she was a good student, if she gets the second rank, I know I've got the first rank. In case if she gets first rank, I know my rank, I'll be the second rank. That's how I used to know the results of that. So those sort of things, it's not one turning point. It's year on year, it was the similar story. And in 10th standard, just before the exams, we had 2-3 months of school, and then I had only one trouser, school trouser. And then on one of the days, my trouser got stuck to the desk, and I had a big tear, and I had to walk home with that. And then my mother said she stitched it, with a big L-shaped stitch, and then she felt really bad to send a 10th standard student to school with a patched trouser. And I didn't have much problem. I said, no, that's fine, don't worry. And she felt really bad. And then but to buy a new trouser, it was only 2 more months.
Oh, okay.
So 2 more months, we can't spend another money for another trouser. So what she cleverly did is she went and bought a jeans type of corduroy jeans type of same color trouser with the intention that can be worn to the college as well.
Okay. Oh,
so
very smart.
Yeah, and in the school they didn't allow us. Again, my mom has to come and speak to the headmaster, get permission, and they allowed us a special kid. They allowed that 2 months to use that trouser, and then I continued on to the college for the trouser for pretty much the most of my first year. I was using the trouser. So those are the little things which always keeps you be grounded actually. So, you come up through that. And now whenever we have things in plenty actually now, I mean, we're not multimillionaires now, but still what we are is, I think, very, very privileged.
Okay. This brings us to a fantastic topic, abundance. When you are talking about plenty, it's about abundance, right? We will definitely
Absolutely.
talk about abundance a little later. But to my viewers, we are not glorifying the financial constraints that people have. The intention is to see what people have done under those financial constraints and how they have moved up in life, right? So don't take this as a glorification of financial constraints. So that's what I would like to tell you. Coming back.
Sure, yeah.
You are a medical doctor. When did that thought come to you that I should become a doctor?
Very interesting, actually. I mean, because the way I grew up, I did tell a lot about my financial situation. So I wanted to finish education as quickly as possible and earn for the family. That was my intention. So medicine was never in my thinking at all.
Why is that?
Because I knew that it's going to take a long time to earn money and support family if you take up medicine, solely because of that. And then I never believed that I had that compassion, empathy to become a doctor at that stage. So the quicker I finished education, I'll be in a job and earn some money. So that was my main intention. So I didn't want to take science in my PUC. And my dad insisted that I take science. See, this is again, people say, oh, you need to allow your kid to do whatever they want. But I'm a very good example where, my father literally forced me to take science. He said, no, don't do. I wanted to do commerce, become a CA. So it's 2 years plus 3 years become, and then 2 years. So much quicker I can earn a living. And he said, no, I want you to do science because you're good in studies. At least you do some engineering.
Very good in math?
I was very good in maths, yeah.
Okay.
Yeah, I was really good at maths.
Why I'm asking this question is there are a lot of kids today who say that, oh, I want to take medicine as my education, so I don't care about math. It is not true. Life is math, right?
Life is absolutely, yeah.
So, irrespective of whether you become a doctor or a CA or whatever it is, you need to get your math right. Sorry to interrupt it, please.
No.
Yeah.
So dad asked me to do science, and then as soon as I took up science in my PUC, then my thought was I'll become an engineer, and I applied to become a textile engineer. So I applied for the textile college in Bangalore, and when I got the results, I was very happy that I got the textile, my first choice.
If I may interrupt, why textile engineering?
Because again, in those days, I wanted to travel.
Okay.
So I thought, if I become a textile engineer and get a job in Raymond's and earn some living and become an executive and fly around the world as part of the work.
Yeah.
So that was the mindset I had. So I got it, and I was very happy. In those days, we used to get the results in the newspaper. So we got those results, got the textile engineering till 12 o'clock, 1 o'clock. Dad bought some sweets, so we gave sweets to the neighbors and friends, and we were very happy. I'm an engineer. And my uncle came at 12, 1 o'clock, and then he looked at the paper in detail, and he looked at that I've got a seat in medicine as well.
Oh, just to interrupt, for the viewers, right? The results were announced, and the medical result was announced on one of the sheets, and engineering was announced on one of the sheets. And if I wanted to become an engineer, I would never even look at the medical results. So that's what happened here.
Yes, true. Yeah, it is. So I didn't look at that. And then my uncle who came, and he was looking for whatever reason, and then he found my number there, and then we got a medical seat in Bangalore Medical College. And he said, okay, so what? So it didn't made me feel anything. Okay, fine. I have got it, but I'm an engineer. So I continued like that. First 2 days, mom and dad did nothing, didn't say anything, and they were happy. But I think a lot of people brainwashed them. Look, you got a seat in Bangalore Medical College. How can you not allow your son to do medicine? And dad slowly started trying to persuade me to do medicine, take up the seat. And there was a gap of like 2 weeks time to go and accept the seat. And I said, no, nothing doing. I knew, medicine it's not because it's a lot harder to study. It is harder, but then the time it takes, people should realize that to become a specialist in medicine is 5 years of medical school, 5.5 years, and then 1 year of internship, 6.5 years. And then you need to do post-graduation for 3 years, MD, MS, whatever. And you spend 1 or 2 years after your medical school to get into the post-graduation. And once you've done the post-graduation, after that, you have to do a super specialization, that is DM. If you see any cardiologist or any specialist in the community now, you need to think what they have gone through. It's after your PUC, they worked for nearly 6.5 plus 3, 9 plus another 3 years. If it is straightforward, it's 12 to 13 years of journey. And if it takes, sometimes a lot of the people will have to spend 1 year or 2 in between to get into the courses. So literally 15, 16 years of hard work after your PUC is when they become a specialist. And then straight away when you come out of the hospital as a specialist, it still takes time to establish yourself to proper senior specialist. So it's 20, 25 years of hard work, and people have to consider that. So I thought at the time, it's too long a journey for me to afford family supporting me. Even though in the government medical college, but I won't have to pay huge fees, but I still have to, takes time for me to earn. So that's why I said no.
How much did you pay?
My MBBS fees was 1,000 rupees every 6 months. So it's 9,000 rupees. I finished my medical education. And in the internship for 1 year, I earned 1,800 rupees was my stipend. So pretty much I earned it very soon in my internship. So I'm very grateful for Indian government to spend so much money on us for medical education.
Why I ask this question in specific is there are kids who get 9,000 rupees as pocket money and they crib.
Times have changed.
Times have changed, but
yeah. So then all this was there, but I said no, I'm not. Medicine is not for me. And that was okay initially. And then as time went on, in the 2 weeks, it took me to different people to convince me, to persuade me to do medicine. And finally, somebody advised me that because you got a seat in Bangalore Medical College, it's like a race course. Even if you're last in the race, you will still be way better than many other horses. So think about before saying no, because you got a seat in Bangalore Medical
Dr.
College.
Babu, could you please talk about why BMC is so special? Bangalore Medical College is so special.
At the time, it was 7th best medical college in the country. And even now, I think it will be in the top 10 if I recall.
Is it number one in Karnataka?
Oh, by a huge margin, actually.
Okay.
Yeah, definitely. Bangalore Medical College, it's a fantastic place. A lot of dedicated teachers and innumerable number of patients, actually. And we owe our profession a lot to patients. We have books. We learn a lot from books, but patients are our real teachers. We learn much more than the books with real people. Yeah. So I think that, again, in Vanavilas, Victoria and Bowring Hospital, where I did my postings, we were not short of patients. So in that way, we were very, very gifted, very blessed.
Yeah. What happened on the day of interview?
So on the day of interview, I still wasn't convinced. So then I was about 4th person to get into the counseling, and I said, look, I need to go down. And the guy, the person was regulating us. He said, no, it's too late. Your chance will come. You can't go down. And I said, no, I've left a document. He said, oh, okay, then come in 5 minutes. I went downstairs to my dad and I told him, I still remember it was when I was 18 at the time. I said, look, Dad, allow me to do what I want to do. And I'll buy you the best doctor in the country to look after. I'll earn so much money and I'll buy you the best in the country to look after you. So please let me go. My brother wanted to do medicine and he said, look, Seshadri is there and let him do medicine. He wants to do medicine and let me do what I want. And he said, my dad, until then, he was only trying to persuade, but then he said he emotionally blackmailed me at the time.
Oh, what was the tagline?
He said, this is, I want, say, I think the words what he said is, I don't care whether I get treated from anyone or not. I think if my son becomes a doctor and helps few people, I'll be more than happy.
Wow.
And after that, it's your choice. So he said, this is what makes me happy. And then it's up to you. And then I very reluctantly had to go and accept the seat. And first year, I wasn't very good in studies because I did. And I went with a condition that if I fail the first year, then you're not going to allow me to continue the second year. Then I'll go back to engineering. That was a condition I had and went on. And then things changed. I started studying and I genuinely felt in love with the subject. And medicine is a phenomenal subject. And the profession, to be a doctor, I think you have to be blessed. Then I never looked back. Once I decided I want to continue in the profession, is when it's a turning point in my career actually. And I never looked back. I became more studious.
Are there any factors which helped you make the decision?
To continue as a doctor?
Yeah.
Yeah, I think at the end of first year, when I started seeing the real patients, I felt that, people come to you in their most vulnerable phase of life. So they're really, really in need of help when they come to you. And when you see that pain and that vulnerability in people, I think most people will become automatic, they become compassionate. And I thought, look, this is, if I'm going to do this day in, day out, and in the process, I also earn some money for living. What can be better than this? I think that once that decision, looking people, real patients is what made me that this is what I want to do for my life.
Okay. Then we'll continue the journey. What happened?
So then I finished my medicine in Bangalore Medical College, and then I wanted to do general medicine, and I was again very fortunate. I got MD general medicine in Ballari. It's again another government college, and that 3 years was phenomenal. Similar story, that a lot of patients in Ballari. So while doing medicine, I was exposed to various specialties. Like we had good cardiology, good neurology. but we did not have dialysis in the hospital at the time. But the subject we studied a lot on kidneys. But when it comes to actual treating, we didn't see any kidney failure patient in the hospital. Once we diagnosed kidney failure, very few people who had a lot of money, they came to Bangalore to dialyze, and we never saw them again. Large majority of people who diagnosed kidney failure, they died with kidney failure. And that was all the exposure I had to medicine, to the nephrology. Then at that time, I decided if I want to become a specialist, I want to do nephrology as a kidney medicine. Because to understand nephrology, the only way is you have to become a nephrologist. And then the reason I would have planning towards my MD, end of MD, I was planning to do DM, nephrology in India. But then I realized how harder it is at home to support me for, I thought another 3 years of whatever stipend we get is just enough for me to sustain. But I can't give any penny to the house. I can't support my family. And then that made me to go abroad. When I looked at the pros and cons, I wanted to go to America, but then it's a lot more expensive. Then the UK was a slightly cheaper option at the time. And then in the UK, as soon as you go, you can start earning. If you get a job, you can start earning and send some money home. So in that way, 2002, I finished my MD, and even before I had my MD results, I was in UK.
How did this idea come into you that you need to go to UK?
At the time, I think large part of was driven by the money factor actually. So you go start earning, and very soon, if you're very lucky, within months, you go there and do the exam, you pass the exam, you get a job, and then you straight away earning pretty decent actually. So that was the main thing. I was so focused on just going there and earning some money and sending money back home. So that was the main driving factor. And in the process, if I can pursue my career as a nephrologist, it's a bonus. So I went to UK, as I said, even before my MD results. I went there, I did my MRCP exam part 1 and the qualifying exam for UK. At one point, I went like 8 hours train journey in UK to sit my qualifying exam. And then on the way back, I was expecting 3 results to come. So one was my MD, which I had done in India, and one was MRCP part 1 as a stepping stone to progress your career in UK, and the qualifying exam to work in the UK, that's PLAB 2. So 3 exams I had given, and I was thinking of the 3, which one would be the most important result? So PLAB 2 was probably the most important result, because then I thought actually the least difficult and the least significant exam was PLAB 2. But at the time, it was the most important, because if you fail PLAB 2, then the next date was in few months, 4 to 5 months. So you have to sustain in UK with hardly any money for months together to get another date. In that way, that was the most crucial exam. If MRCP part 1, if you fail, you only lose the exam fee, you can sit it again. And
how much was the exam?
At the time, 30,000 rupees. Yeah. And the final one was the MD. So if I lose MD, I think in my heart, I wanted to pass the MD, because if I failed that, I would have never come back and sat the exam again. And for my entire life, I would have like in a bracket MD. I did MD, but I never passed. So that was the thing. But again, God's grace, I got all the 3 results in a span of 10 days, and I passed all the exams. And it's a huge relief. And again, right time in the right place. I got the job very quickly, and then no looking back. And within a couple of months, I used to send money home and clear a lot of the debts, made family comfortable.
Fantastic. Can you talk about your experience in UK? We'll come back to some of the failures that you have gone through in your early days. But before that, we will complete the UK portion and come back to it.
Yeah. When I started UK, as I said, I went to UK in 2002 and did the exams. The first few exams, part 1 and part 2 of MRCP, was pretty straightforward, very easy. And I did pass my 3rd part of MRCP within a year and a half. I did all. I think the fact that I went after MD. A lot of in UK people go after MBBS, and some people go after MD. So because I went after MD, I was very good in the subject. So it helped me to progress my career much quicker in UK. And when I went again, they said nephrology was the most difficult, one of the difficult subjects to proceed your career in. So I was pretty convinced I'm not doing anything else. If I don't get nephrology in UK, I was pretty confident. I learn some money, come back to India, sit the DM exam, and continue my journey with nephrology in India. But again, very lucky. I got into nephrology, which I wanted. And it's a 5 years training in nephrology. Again, fortunate to do nephrology in West Midlands, which is, and some wonderful hospitals. And 2003, 2003 is it? 2002 I went. 2009, I finished my specialty training in nephrology, and I became a consultant in end of 2009 or 2010. I became a consultant, and it's been like 15 years.
Which part of UK do you work?
Currently, I work in Wolverhampton,
Okay.
which is in Midlands, close to Birmingham. And I worked in a couple of hospitals in Birmingham, but last 8 years is in Wolverhampton as a senior consultant in nephrology.
Okay. What does senior consultant mean to a patient approaching you? Who wants to consult with you? What does it mean to you? It could be in terms of the waiting times. It could be in terms of how soon can they see you.
Well, this is one of the things I need to tell people in India. People are extremely fortunate here because the speed at which they can access specialist healthcare. The money is another issue, but if you can, but to get to the specialist, it's pretty easy. I think last week I wanted an opinion from my own sister with the gastroenterologist and the upper GI surgeon. I went to the hospital, obviously because I know some people, even otherwise it's not difficult. If you phone around within 1 to 2 days, most specialists you can get access to. And unfortunately, I think a lot of people in India don't realize that fact, that how lucky they are. Whereas I'll tell you the scenario in UK. If you want to see any specialist in UK, you can't directly go and access them. You have to go to your own primary doctor first, and they need to feel the need that it needs a specialist review. And once they decide, they will refer it to the hospital, and then you go in the waiting list. Once we decide, then I look at the reference and say, okay, I want to see this patient, needs my input. And then once I say yes, then they go on the waiting list, and it will be a couple of months before they can see me. And not just me, like any specialist, that is the process is. The specialties, some of the specialties, it can be waiting time could be up to 6 months. Then people you might ask like, okay, then what happens if they become serious? I mean, there are emergencies. So we do prioritize. Suppose if somebody if I think that they need to be seen much earlier, we have a way to bring them earlier.
Okay.
But in general, if they can wait, and that's the general waiting time. And people absolutely got no idea in India that how privileged they are because they can go and see and get care as quickly as possible. I mean, in my hospital, in most UK hospitals now, to get a CT scan, it's a couple of days, even for inpatient and MRI scans. There is the delay, but the brighter side of that is then they don't have to pay in the UK. So it's the state-sponsored healthcare, National Health Service. It's free at the point of care, and so virtually there's no money transaction at all.
Okay.
So that is the benefit, but the waiting time is, unfortunate, it is there. In India, this other side is, yes, you have to pay, but there are still good institutes where if you can't afford, there are a lot of hospitals where you can go and get healthcare at a reduced cost or even free. If you have a lot of various government schemes, you can get good care. And I think that's a privilege in India, and people should realize that.
Fantastic. We talked about your profession, your education. Before we go back to your childhood or earlier part of your formative years and talk about few challenges or failures that you faced, Can we talk about your family if you are comfortable?
Sure.
Very crisply
Yeah.
about your family.
2003, I got married to Padmini. She's one of our close relatives. She's a dentist, and we got married in 2010 and she came to UK straight away. And we're blessed with two boys. My oldest son is 18 and youngest son is 13, Anshu and Apurva. My oldest son got into medicine
Was he inspired by you?
few months back. I would say inspired by me, but I'm very proud that he did choose to become a doctor. I think this dilemma of a lot of doctors now thinking whether they should send their kids to medicine or not is still going on. There's a lot of debate, and some doctors genuinely feel that it's not the profession that we should pursue. But I beg to differ on that. There are challenges. There are challenges in most professions. Same with medicine. And my son, when he came to the situation like 2 years ago, whether he should do what he should do, he wasn't 100% sure that he wants to do medicine. But then I asked him, look, are you passionate in doing anything? And he wasn't that passionate in like, I want to do this in life. But then I said, look, if you don't have anything really serious, I would suggest you do medicine. Because the starting point for him is a lot better than when I started my career.
Absolutely, yeah.
And yes, if you do medicine in the UK, it's a standard practice. You probably can't buy a Ferrari.
Okay.
As a doctor in the NHS, it's not easy to earn mega bucks. But you can have a comfortable life. You can have a good house, good car, probably 1 or 2 holidays in a year. You can pursue your passion in hobby. So it's a pretty good life actually. I mean, compared to a lot majority of people, if you have these facilities, I think you're in the top statistics wise, you're in the top 1% or less than 1% in the world population. So I said to him, look, you're in that. So what else you want? We all want to earn money, but if you can help people in the process and earn money, it is a blessing. So, and he has seen me and I'm pretty happy in my job, and probably that would have influenced him as well. And I'm so glad. He worked really hard, and I would say a lot harder than what I did. See, this is again, for me, it was a necessity. But for my son, it wasn't a necessity. He didn't have to work that hard.
Okay.
But I think it's a lot of credit to my wife. She is very strict. She really would push the kids to do well in studies. And I think large part of my son's success should go to my wife
Fantastic.
for doing medicine.
Congratulations to Padmini.
Thank you.
Has anybody told you that you are lucky in life?
A lot of the times, actually. A lot of the times. I think people think that you always get into right time in the right place and the journey is easy for you. It is the perception.
Why does that happen to you and not to so many people? What is so special about you?
No, I don't think I'm special at all. I think.
Let me paraphrase it. How open are you mentally at a mind level? What is your thought process so that you can receive all this abundance?
I think very early on, I sort of got into a phase of being content. So for me, from where I came from and what I am now, I'm very, very blessed. And again, I've told you that a lot of people's hard work is what has made me to where I am. So in terms of contentment, I mean, I don't want anything more. If I can continue what I'm doing, we need to be very grateful. So to get up in the morning and go to work, love what you're doing. Because see, the reason why I said medicine is so special is because you see every single day we see people who are in a much disadvantaged position. Mm-hmm. And diseases come to you, the problems come to you, you never asked for it and it just happens. And it's sad that to deal with. But then when I see a patient with, say, I mean, one of the things you asked earlier is, why are you so empathetic? I think, see, when I see people younger than me with the diagnosis, life-threatening conditions, they come to me. And then you think, okay, fine. In the early years, I used to be very sympathetic towards them. But then I realized, well, it can happen. What prevents you from having that? See, tomorrow we are talking here, and very next tomorrow we might be diagnosed with much worse condition than that. Just a matter of time. So we're not, being doctors is, we're not immune to all the illnesses and issues with health. So for that, the very fact that you get up in the morning, go to work, walk around, is a privilege. And we need to have that gratitude in life.
Do you practice it? Purposefully, do you practice it, or how does it happen to you?
I have the constant feeling of that, how blessed we are. So I think that feeling helps me to, and again, see, I want to tell another thing. If you say, why do you help people, or see, we are in a position, if you get a chance to help someone, we need to feel we are lucky, because it's the way of God giving you an opportunity to be of some use. And you might refuse it once. You might refuse it twice. And then God won't give you more opportunities. So it's your loss.
Okay.
If you get an opportunity to do something good, and if you don't do it, it's your loss.
Very profound.
Yeah. And so you should be privileged to be in the position to be of some use to somebody. Maybe in treating, or any general kindness you show towards fellow human beings. I think you're in a position, you need to grab that opportunity to help people or be kind to people. So I sort of firm believer in that. So if I get a chance, then I'm very lucky, because the God has chosen me to do that good thing.
Is there an example when you were not compassionate and you regretted it later?
See, again, the profession what we are, even though we want to do good every single time, we want to save every single patient who comes to us. Sometimes we know we can't cure the patient, but we can care everyone. See, there is a big a difference between cure and care. One of the things, as you mentioned at the beginning, you said the example where you give of your dad. Yes, we need to try for the cure as hard as possible, but when time comes, that cure should take the back seat, and the care becomes very important. So that's where, but what we can, even when we can't cure, we can certainly care every single patient. But mistakes do happen in the profession. I mean, at the end of the day, we are humans. So when things happen, when you can't save people, or when people die because of your actions, it is very hard. I think that is one of the challenges in the profession. And it's happened to us. It's happened to all of us. So we try to do certain things, and then patient reacts badly, or the complications do happen. And these are the recognized complications of a procedure. People die. And when it happens, you feel profoundly sad for the loss of a life. But then we have to move on. So I think that's probably one of the biggest challenges. It's happened to me.
Okay.
People have died, not many times people have died as a complication of a treatment, what I've done, of the procedure, what I've done. And we have to learn from it. And then I think the best we can do is, yes, it takes time. As I said, the emotions will come in, but the best thing to move forward is, what do we learn from that? How do we prevent that from happening? And in the UK, we've got a very good process, what we call it as root cause analysis. Whenever a near misses happen, the death happens, we introspect, we look at and see if there's any lessons can be learned. And then if we find something, then we will incorporate that in the future practice and spread it to the entire trust.
Okay. Let's get back to your earlier days. You can pick and choose whichever failure or vulnerability that you want to talk about. If you are comfortable talking about one or two examples of your failures, and what was your thought process to come out of it? How did you tackle them? And where did that wisdom or experience come from? Did it come from external sources like your parents, your family, your friends? What was it?
Large part of my school and college life in the UK, in India, was pretty successful in terms of academic success. Wasn't difficult. I did well. And then when I went to UK, as I was selling the process of MRCP, I did the first time I failed in an exam of me not performing was in UK MRCP PACES exam. So I failed the exam first time by just 1 mark. Then I thought, okay, it happened. It's only 1 mark, so I should be pretty close. And I took the exam in 4 months after. And when I took the second time, I failed by 4 marks. So that was significant.
Yeah.
And when I failed for the first time, that's the first time ever you sort of failed the exam because of your fault.
Okay.
It was very, very difficult to take. But second time when I failed, it hit me very badly. And then I thought, okay, when I took the third time, it's the third and the final time. If you fail the third time, then you have to go and do the written exams again, which means your career progression will delay significantly because you have to do the written exams. So the third time when I did the exam, I tried to understand the process. So, okay, this is the exam and this is what is expected out of you. How can you do way better? And I don't want to bore you with all the process of that, but it's the understanding of the examination is what is very crucial for a student at any level. I think a lot of people do study hard and they say, look, I worked very hard, but I didn't get the results I wanted. I'm not very lucky in that way. I'm unlucky that I don't do well in the exams. But I think it's very important for students to understand, yes, it's not the information, it's not the knowledge. It is the success is based on what the exam wants, what the examiner looks at you. That is what the success is. So if you can focus on what the exam is and prepare in a certain way to get the results for the exam, it helps you a lot actually.
Would a small amount of fear of failing help you in progressing well?
I think, see, until that time, I never failed in the past. So it wasn't difficult. So when you fail for the first time, then you realize what has happened. It wasn't easy. I think the fact that to tell somebody that what happened to your result, I failed in an exam. But thankfully, again, in the UK, it's not as uncommon as here. So a lot of people fail the MRCP exams. So the pass percentage was less than 50%. So in that way, you got half the people who took the exam have failed. So you don't feel that bad.
Since you have been part of, sorry, I interrupted you.
Sure, yeah.
Since you have been part of both the systems, you just said that people in UK, 50%, around 50% would fail. Are they open in saying that I failed this exam? And what is the cultural difference in accepting the failures and learning from failures in both the cultures?
See, in India, the failure is been seen as that you failed. Failing an exam means that you almost failed in your life. So, which is very sad. It isn't the case. It isn't the case. I mean, I'm sure we've got examples of a lot of college dropouts ruling us currently.
Yeah, that's true.
So, I think failure in school or college should be taken as just a small part. In the Western culture, it is easily accepted. Okay, you failed the exam, you failed the exam. Exam is just an exam. So, can move on. Early stages, people don't take failure as significant in the school level. But higher levels is where people fail. And it's pretty easily accepted. And there's no shame in accepting that, you failed an exam, you carry on. But in India, I think one is the social stigma of failing. And the second thing is also it's huge in terms of cost and the time.
Yeah. We are very closely approaching to the period of examination. Do you have anything to tell the kids in 10th and 12th?
I think the competition here is gone to the level of it's really, really hard. I think the margin is so small. Feel a bit hard that children have to get into the course what you want. It's become almost abnormally. It's abnormal that people have to work so hard to get to the exams. But again, if you look at what is alternative, there are so many children and they want their only limited seats. It is tough. Again, it's the lot of diversification in India now. It's not just the medicine, engineering. There is a lot of people are choosing various careers. Some of the jobs which people do now in our times, we never heard of those things. And so it's good to see that in this way. But the people who want to get into certain specialties, certain areas of education, it is tough, but it is sad, but that's a challenge. And I think if you can't get into your work, I mean, see, as I said again, you need to learn to understand what the exam needs and then prepare. Then if everybody does that, obviously if everyone becomes smart and learn what the exam, then the percentage will become really, really tough. So there is that bit as well.
Okay. Is there anything that you want to, since we are coming to the end of this conversation, is there anything that you want to say?
In terms of, this again, one of the things which you said is being empathetic. And if you see somebody in a difficult situation, earlier used to be sympathetic. Now I'm more empathetic, not necessarily being sympathetic. That is because I've realized it is it's a cycle of life. And most people will have ups and downs. And it's only if I see someone in a difficult situation, it is that time of life where they are. And the only thing is, there's no constant. It's changing. So it won't stay like that. Things will get better. I think if people realize that, yes, the difficult times are there, but the difficult times is not going to last. In the same way, the people when you're at the top, even that can't go on for long. So it's ups and downs. Life has got lots of ups and downs. So when you're down, don't be too disheartened. Things will change. And similarly, when you're successful, you shouldn't get into your head because it's just a matter of seconds, not even minutes. Within seconds, things can change. So be mindful of that. And I think large part of us are in abundance. What you said, we've got much more than what we need. Plenty more than what we need. But the fact that the sad thing is people don't realize that. Mm-hmm. So when you have everything, you want to go in search of something which is not there. And lose out on all the privileges they have. I think that's one of the sad parts of a lot of people. I think,
what you're saying is have gratitude for what you have. That does not mean that you should not be ambitious. You can be ambitious in life, but be happy with what you have now.
Yeah. And then if you stop at being ambitious, then the progress stops.
Yeah.
Progress stops. So we have to achieve in the process. I think, it's not the achievement at the end. It is the process, what you need to enjoy.
Yeah.
By the time you achieve something, you already put in so much work. See, the momentary success, the achievement will give you a short period of that high. But it's the journey is what is very, very crucial. I think people should enjoy that.
Yeah. Thank you so much. Do you want to ask me anything? Or
well, I mean, as I said, when you said that you want to talk to me and start this podcast, I felt like, why me?
Why you? Because first thing is I know you very well. I'm not saying that, okay, I know you very well, that because of that you should be on the podcast. And that's not what I meant. What I meant was, since I know you very well, meaning where you have come from, where did you start your life, and where you have reached. And you have seen most of the failures, successes, different geographies, different cultures. And I think you will have a very, very rich experience to share. And of course, this podcast has been wonderful so far, and the experiences that you have shared from different parts of your life definitely is very enriching to me and the viewers here. So that was the reason that I approached you, and thank you so much for inviting and in accepting my invitation. And thanks a ton.
Thank you so much, SK. You said if you want to add something, can I just tell about 2 minutes, a few minutes? See, the example which you said that your dad was in a situation, and I did say things. See, in India now, the one perception is that we want to keep our loved ones alive as long as possible.
Yeah.
And when the situation is, the concept of palliative care or end of life care is not very well developed.
Correct.
In India. But there are some centers. I mean, for example, in Bangalore, we are very lucky that we've got Karunashraya Hospital, which is a palliative care hospital. It's got fantastic facilities and great staff who do good end of life care. I think the concept of end of life care is, see, when the cure ends and when I say the care starts, there should be a concept of people having good death. We always talk about good health. And there is also a very, very significant part is good death. So how...
Can I interrupt you?
Sure.
Death is very scary for people. How do you make it less scary?
Yes. See, we are all aware that everyone who's born has to die. So death is the only two certain things in life is birth and death. So death happens. But I think if you talk to spiritual people, they think that death is just the body leaving and the soul is never dies.
Yeah.
And if you think along those lines, it's not too difficult to accept that. But we are in a world where large majority of the people are scared of death. And we as doctors, we are in a position where we can be there at the time and be helpful. And the thing is, I think people in India have to slowly realize that at some point, we have to let go of them. Letting them go in a peaceful way is massively important. See, if people can voice their opinions, then it's fine. They say, look, I don't want that ITU care and I don't want this, I don't want that, I want to go peacefully. That's fine. But a lot of the times they are in a position where they won't be in a position to make a decision. They're not communicative, they're less responsive, and the decision entirely lies on the family to make the choices. So I think we need to understand and give them good death. So there is a lot of scope for palliative care in India. And as part of nephrologists, I do dialysis, we keep people alive, and at the time when it comes where we realize people are not benefiting from dialysis, we help them to stop dialysis and have good death as a part of renal palliative care. And that's one of my special areas, and I've learned a lot from that.
Okay, you talked about, when we were talking about death, you talked about good death and not so good death. Oh, what is the difference?
Okay. It's not easy, but I'll try to explain that in a few simple words. Say, for example, when people are in intensive care with a lot of life-supporting machines, there comes a stage where it's only the machines who are keeping them alive. So if you take the tube out, that pretty much they're dead. But what we want is, we want to keep them alive on the machine for as long as. So you're only prolonging the misery. So the eventuality is that they're going to die. So they're only alive because of the support system.
Yep.
Otherwise, but so there comes a point where, as medical faculty, we realize that this is certain that it's going to happen, and then we explain to the family, and that is the process. So if you allow them not to stop the life-saving interventions, like dying with a lot of tubes around and not family around in the intensive care is probably not a good death. And sometimes when there is a situation where we're pretty certain that this treatment patient does not respond to this treatment, but we still want to go ahead and put them through so much more pain and suffering. and prolonging the inevitable is probably not a good death.
Sure.
So I think, see, when the whole family is around and being cared for, pain-free, comfortable, put some nice music, family, everybody, loved ones sit around and they give them a good send-off, is probably a very good death.
Does that happen in UK?
A large part of the times it does happen, yeah. There are times where we get challenges as well, where the family doesn't agree and then we have to talk to them more and more. Large majority of the times we can convince them, we can understand them, and it does work actually. That is bit less in, not as good as that. In India, it's not, the concept of good death is still
Okay.
not there.
Thank you very much, and see you around next time when you are here.
Thank you, SK.
I loved this conversation, and thanks a ton.
Thank you.